Now I want to look at a very strong this is, what do they call it, instruction in the radiology lab, and also give reasons why this instruction is there. So this instruction is that patients should not have a radio opaque object on their dress when they are imaging. So I want to now look at what is a radio opaque, and of course why is this rule set in place. So you can see a radio opaque stuff will actually what appear on the radiation imaging, and of course it will disrupt, okay. So for radio opaque objects, you are talking about objects that can be able to block or absorb x-rays. So some common radio opaque objects that patients usually have on their body during imaging include things like metals, jewelries, zippers, coins, some certain fabrics that probably they use metallic threads in them. Especially women, they wear a lot of fashion. So when those things are present on the patient clothing during imaging, they usually interfere with the diagnosis. So what if there's a pathology behind this? First issue is image quality and artifacts. So radio opaque objects, they appear as bright or white areas on the image. So they'll cover the underlying anatomy. So even if there was a disease condition beneath, you will not be able to read it properly now. Do you understand? They can obscure the underlying anatomy, making it difficult for you to see bones, organs, and soft tissues clearly. So, and sometimes it might mimic as if it's a pathology. Do you understand? That's if you didn't actually know, or if the patient didn't complain. Okay, so misinterpretation risk. Radio opaque, okay, they can be mistaken and the rest of it. The repeated exposure. So sometimes because you have a radio opaque stuff on the imaging, it scatters how good the image would be like. So they have to now do the imaging again. So a patient is exposed to radiography, that's radiation energy, all over again, simply because there was a mistake. And this mistake is even on the part of the radiography person, because you're supposed to clearly instruct the patient that you should take up all jewelries and all metallic stuffs. You see that? So diagnostic accuracy, clear visualization of the anatomy is very important in diagnosis. So if radio opaque are actually blocking a part of the body, is an inconclusive radiograph. So workflow efficiency, you have to remove the objects before imaging, save time to prevent interruptions, and also avoid repeat scans.